Hello, my name is Michelle Embleton, and in this video I want to talk about what is donor sperm intrauterine insemination and how much does it cost. Intrauterine insemination, also known as artificial insemination, is an assisted reproductive technique that can be taken place using either your partner's sperm or donor sperm. In this video I want to focus on the use of donor sperm. So we're going to look at when is this treatment recommended and how does it work? I want to talk about the advantages and disadvantages of using donor sperm artificial insemination. We'll have a look at how successful is this treatment and how much does it cost. I also want to talk a little bit about legal aspects of the use of donor sperm for artificial insemination. Then we'll finish by having a look at some of the most frequently asked questions and answer them for you. Artificial insemination, also known as intrauterine insemination, is a fairly simple assisted reproduction technique whereby the artificial insemination is performed with donor sperm. Some of the main reasons for choosing artificial insemination with donor sperm as your assisted reproduction technique are, for example, single women who choose to become single mothers without a partner. In this case, donor sperm will be needed. Also, in same-sex female couples, a donor sperm sample will be required in order to achieve pregnancy. If there is a risk of genetic diseases from the father, you can also consider using donor sperm. However, you can also think first about doing IVF with pre-implantation genetic diagnosis. So there are other options available in this case. In cases of very severe male infertility, such as azoospermia, or indeed just a very low sperm count or poor sperm morphology or motility. Sometimes when other assisted reproduction techniques have failed, such as IVF cycles using your partner's sperm, you may want to try using donor sperm and go back to an artificial insemination, which is a simpler technique, but with donor sperm. In the past, this technique was commonly used for example, men who are seropositive for HIV. But nowadays we have the technique of sperm washing, in which the sperm sample can be prepared so it doesn't have any traces of the viral particle. So it's not necessarily being HIV positive is not necessarily an indication for doing donor sperm artificial insemination. In our society today, the idea of what constitutes a family is constantly changing, evolving and adapting. And it is true that there are several women who get to the ages of 35 to 40 and haven't found themselves within the stable relationship they wanted to become mothers, and so look at the idea of becoming mothers themselves as a single mother, in which case they will turn to using donor sperm. And this is a good treatment in these cases. In the case of homosexual women, they can also use intrauterine insemination with donor sperm to try to become mothers. And the legal aspects of this do vary between country to country, state to state. For example, in Spain, the couple does not have to be in a married relationship in order for them both to become mothers. When the treatment is done in a correctly licensed fertility clinic, both women will sign the consent forms, and as a result, both women will be recognised as the legal mothers. In the United Kingdom, the women, as long as they are in a civil partnership or a marriage, they will both be considered as the legal mothers. In the United States, laws can vary depending on where your donor sperm comes from and also from state to state. So it is recommendable to take legal advice to make sure that you are both the mothers of the children. Well, artificial insemination, whether we use partner sperm or donor sperm, is basically the same process, but we're going to focus on the use of donor sperm here. When we use partner sperm for an artificial insemination process, it can be donated fresh, but donor sperm will have been frozen for at least 6 months previous to the insemination process. This is to allow sufficient time for the necessary testing to make sure there are no infections and any other genetic disease tests that may be required. The first step is a controlled ovarian stimulation, in which the woman will take medication in order to stimulate the growth of the eggs within her ovaries. This is a mild form of ovarian stimulation. intended to develop maybe 1 or 2 eggs. At the correct time, the ovulation of the eggs is then induced again with hormonal treatment. Then we have the semen thawing. The semen sample needs to be thawed, and then it will be processed. It will be checked with a semen analysis to do a total sperm count to make sure the sperm have survived. It will then be capacitated, ready for use in the insemination. The artificial insemination or intrauterine insemination is the process by which the sperm sample is introduced into the uterus via an insemination cannula. This is a simple procedure and doesn't require any anesthesia. This will then be followed by the 2-week wait, the beta weight, which needs to be respected before taking the pregnancy test to see if the treatment was successful. In the United States, it is possible to choose your sperm donor if you wish. However, anonymously donated sperm is also available. In many other countries, however, you cannot choose your sperm donor. The donation of gametes is a totally anonymous and altruistic process. In this case, it is the clinic themselves that will choose who is your sperm donor. The clinic will choose the most suitable donor based on things such as phenotype, that their characteristics are similar, perhaps with eye colour, hair colour, height, etc. Also, they will make sure that immunologically they are matching, such as blood types. And if there are any genetic diseases that run in your family, they may want to make sure there is a genetic compatibility as well, in a genetic matching process. The woman or the couple undergoing the treatment will only receive general information about the donor. So, for example, their height, their eye colour, but will not receive any identifying information to make sure that the process remains anonymous. In order to become a sperm donor, a man does need to be of usually between 18 and 35 years old, possess very high quality semen, have a karyotype study done to make sure that there are no chromosomal abnormalities, and also be free of any infectious diseases or genetic diseases. They will also have to undergo general health testing and psychological testing, and the criteria for becoming a sperm donor is actually very strict, and only 1 out of every 10 men are usually accepted as a sperm donor. As a result, the donor sperm is usually of very good quality. As with any assisted reproductive technique, there are always advantages and disadvantages associated with the treatment, which you need to look at before deciding if it's right for you. Let's start with the advantages. Artificial insemination is one of the simplest and least expensive treatments. It is also closest to that of natural conception, since fertilization takes place within the woman's body. It is a painless technique and doesn't require any anesthesia, so the patient usually feels much calmer. It can be performed within a natural cycle without the need for any ovarian stimulation, but by performing an ovarian stimulation, you can further increase the chances of the success, as you know ovulation is going to be induced, so you are correctly timing the introduction of the sperm when the egg is there. The levels of hormones taken for the ovarian stimulation are very low with artificial insemination, so there is a very, very low risk of any complications from this medication. Other advantages are that the success rates of using donor sperm with artificial insemination are higher than when using partner sperm, and it's also advantageous as it has allowed single women and homosexual women to become mothers without them being in a partnership with a man. Although there are benefits, we also need to look at the disadvantages, and these can include a very low risk of infections. Although this is unlikely, there is always a risk of infection with any procedure. There's also a small risk of allergies with any procedure. The chances of having a multiple pregnancy are increased compared to natural pregnancy, with a 12% chance of having 2 babies or perhaps more. There is a small risk of ovarian hyperstimulation syndrome due to the ovarian stimulation. However, this is a much lower risk than with other treatments such as IVF. Another potential disadvantage is that the man has to come to terms with the fact that their children will not have their genetic load when donor sperm is used. And this is something which can be difficult for men to accept. In these cases, psychological counselling can really help before undergoing the treatment. intrauterine insemination with donor sperm generally has greater success rates than the same treatment using partner sperm. And this is because donor sperm is of exceptional quality and comes from young, fit, healthy men. However, one of the most important factors to consider when looking at the success of this treatment is actually the age of the recipient woman, as the age of the woman usually will determine the quality and quantity of her eggs. To have a look at the statistics of success, I have available the Spanish Fertility Society's data from 2020. And in this data, we can see that for women under the age of 35, the success rate in terms of delivery of healthy baby is approximately 17.8% when performed with donor sperm and 10.9% when performed with partner sperm. When the age range of the recipient woman, the mother, is between 35 and 39, the birth rate is 13.3% when using donor sperm and 8.9% when using partner sperm. When women are over 40 years old, the treatment is generally less successful, with a success birth rate of 5.8% for using donor sperm and 4% for using partner sperm. The success rate when performing an intrauterine insemination is cumulative, meaning that the more attempts you try, the more likely you are to get pregnant. For this reason, if it doesn't work the first time, you will be encouraged to repeat the process, maybe up to 4 times. In the case of single women or same-sex female couples where there are no fertility issues, you may be suggested to try the treatment up to 6 times. Whilst in the majority of countries, sperm donors are not paid for the donation of sperm, as it is seen as an altruistic and anonymous act, it is true that a sperm donor will receive financial compensation for their inconveniences that have been caused to them in the donation process. For this reason, using donated sperm for an IUI treatment will be more expensive than when doing a partner sperm artificial insemination. In the United States, you can buy your sperm sample from a sperm bank and select which one you want. So obviously the price of sperm can vary from clinic to clinic. As an orientative price in the United States, the cost of artificial insemination with donor sperm is between $1,000 and $1,700. You also need to add to this the price of the hormonal medication needed to do the ovarian stimulation. That could be between $500 and $1,000. As with any assisted reproductive technique, it is always best to consult properly about what is included in the price of your treatment, how many attempts will be included in the price of your treatment before signing and going ahead with the treatment. A sperm donor agreement is something that may be needed when you have a known sperm donor. So when your sperm donor has been selected without using a sperm bank. In spite of all the excitement of becoming parents, it is always important to take a step back and look at what are the legal requirements of this process and do I need to sign an agreement beforehand. If you use a known donor for the sperm, you need to think about any children born from this treatment. Would you want them to know who the biological father of the children is? Would you want this man to be involved in bringing up the children? So you do need to consult legal advice and draw up an agreement whereby you look at the access rights, any financial contributions, and who are the legal parents of the children. Now we'll have a look at some of the most frequently asked questions from my users and answer them for you. How many attempts at donor IUI should we try? Well, the general recommendation for this is between 3 and 6 attempts, depending on your particular situation. Nevertheless, most clinics don't recommend this treatment if you are over 38 to 40 years old, as it doesn't have a high probability of success. How successful is donor intrauterine insemination for women in their 40s? After the age of 40, a woman will find it more difficult to get pregnant using this technique, as the quantity and quality of her egg cells will be decreasing. Also, the accumulative genetic damage and chromosomal abnormalities mean that there is a greater chance of miscarriage should she get pregnant. This doesn't mean it is impossible, but just less likely, and as a result, other techniques may be recommended for you. Donor IUI is usually recommended for women under the age of 35. We hope you have enjoyed this video and found it useful. If you have any experiences of artificial insemination or using donor sperm, please leave us a comment below to share with us your experiences. And if you found this video useful, don't forget to click like and subscribe so you don't miss any future videos. And finally, I'd like to remind you that in the description below, I leave you with a link to an article where you can find all this information in greater detail. Thank you.